Remote patient monitoring is a program built within Leave Virtual where patients have access to equipment in their home to monitor their vital signs to help decrease opportunities for unnecessary hospital admissions or ER visits, extra visits to your doctor's office, and to provide intervention early as possible to simple changes in your current diagnosis.
Typically, patients will receive a kit upon discharge, either from the hospital or one will be ordered on their behalf, where then they would receive it in their comfort of their own homes. Typically, the kit entails a pulse oximeter finger device, is how we tend to convey or express it, a scale, as well as a blood pressure and a tablet app, where then patients would measure their daily vital signs and transmit them via our platform for us to review, and then determine if additional follow-up interventions are required. It's very important to rest prior to taking vital signs and provide the driest weight possible. Typically, the recommendation entails daily weights captured in the early morning, after utilizing the restroom. Very little to no clothing is our recommendation, and prior to eating or drinking. Again, with regards to blood pressures, we also recommend at least 2 hours after taking prescribed medications. Daily testing is rather important because clearly we like to establish trends. We like to be able to monitor and, as previously stated, intervene if necessary.
The most important thing to remember is you have to consistently take this data. There's going to be several things that you're going to be testing, one of which is blood pressure. If I can give a word of advice to all the patients, it would be make sure the blood pressure is taken not around any activity. We have a lot of patients that all of a sudden say, oh my goodness, I didn't take my blood pressure, and are taking it after they just came in from mowing the lawn. So we definitely don't want you to do that. The blood pressure has to be when you are sitting in a chair, feet flat on the ground, and make sure that the cuff is securely wrapped around your arm. Hold the arm out at heart level, straight out. If in fact, and you may get an elevated reading, we do ask that you remove the cuff and then retake the blood pressure after 10 minutes. The other thing that you really have to keep in mind with blood pressure is we want a reading that is taken 2 hours after you have taken your medication. This is going to give us the best view of how that medication is working, particularly for you. Another vital that you are going to be taking is the pulse ox. Pulse ox is something that you have to just make sure your finger is in there firmly and your hands are not cold. Other metric that we're going to be taking a look at is your weight. We always want a first morning weight after going to the bathroom and before you eat or drink anything. Please make sure that you wear basically the same amount of clothing every day. Obviously, if you have heavier clothing on one day over another, it's going to make a big difference.
As part of the program, you're assigned an RPM nurse who works with you throughout the program. If there's any type of problem, she will bring it to an RPM provider that you were assigned. The RPM provider will then decide what needs to happen from there. Is it something that they can handle, or if it needs to be brought to the attention of one of your providers, such as your primary care doctor or cardiologist or a pulmonologist. We're kind of like an added layer to monitor your condition and then keep you out of the hospital if possible.
Home monitoring helps patients detect changes in their health early on, which can keep them out of the hospital and also reduce their emergency room visits.
The average amount of time to be enrolled in the program is 90 days. Sometimes patients may need to be enrolled a little bit longer if they're having ongoing health issues. And once they're discharged from the program, we will notify them when it is time for them to return their equipment.